Senate Minority Leader Harold Jones. It's good to talk to you here just a few days before we kick off the session.
Yeah, absolutely. Just a few days before we kick off the session, people asked me how my off session was. I really didn't have one, being minority leader now. But it is kind of like, I think you were saying about going to school, new school year.
It's got that new school year smell a little bit. Everyone's getting ready, figuring out where they park.
Everybody's really ready to go. They're energized, they're excited. As I said, nobody's been picked on yet. But all of those things will change in due time. But right now, everybody's really energized and really looking forward to session.
Let's talk about this upcoming year, because this is the time of year where lawmakers are kind of looking at the blank whiteboard in some ways. Obviously, you've been planning for some time, but it's a blank slate what's going to happen over these next weeks and months. Going into the 2026 session, what is your #1 priority legislatively?
I think it encompasses various areas. And when you start talking about the new big buzzword, of course, is affordability. And so I think that's one of the things we'll be looking at. But what does that actually mean? It really means, what can we do as a legislative body to actually help you be able to afford health care, to be able to afford a house, to be able to afford your groceries? And I think those are the things that we're going to be looking at to determine what we can do to make those processes easier. And so when we start talking about affordability, what could be more affordable if you have a home? If you're a renter, we ought to give counties the opportunity, at least, to where they can do some rent control. What can be more affordable to make sure that we don't have private equity buying up so many homes that people cannot buy, and then they rent them out at high rates? So that's the kind of things that we can actually touch on as far as housing is concerned. Of course, healthcare, we know where the big issue is there. We want to make sure people can actually afford their healthcare. What can be more affordable to make sure that we can actually stop hospitals from closing, that people can actually pay their bills? And to do that, we know Medicaid expansion is going to be one of the areas. And of course, we also had a bill last year to deal with the subsidies, to where the state could provide its own subsidies, similar to the federal government. So those are the things we're talking about. So when you hear that buzzword affordability, what that really means is, what can we do as a body to actually make those things more affordable? And there are things we can do.
You tee up another thing I want to ask you, which is, the natural follow-up of how do you do all this stuff? Yeah. And you've alluded a little bit to some of the framework that you're using to think about these issues. But let me pose this question to you this way. You're the minority leader, not the majority leader.
Right.
Democrats are the minority party in the Senate and the House. Republicans control the governor's mansion as well. Democrats are the out-of-power party in Georgia. You have these legislative goals. As a member of the out-of-power party, rather, Democrats don't control the state.
Don't control the state.
How do you get these goals done anyway?
I think one of the things you want to do is actually make the case to the people, and I think that's the key. And if you really look at how we've been doing things over the last year, and even a few years before that, we've actually been making that case to the people from a Democratic standpoint and saying these are actually the differences between the two parties. And I think you've seen that, of course, in the PSC race. We already saw that, where we had differences laid out, and we saw two Democrats be able to win that. We've overperformed in other races. On the Senate side, of course, we just won a House race, too. And we're actually doing pretty good in this race that's coming up to replace Senator Kennedy. So I think that's the first part, is how do we actually get our message out to the people? And the way you have to do that is show them that there are actually different ideas that are actually out there. There are places that we have agreement. But the key thing is to say, this is what Democrats believe in. I think that's a little bit different than we've kind of seen in the past. I think from our side, from the Senate, and even from the House, you're seeing us say, this is what Democrats believe in. We're not trying to be Republican light. We're saying this is what we believe in, to try to actually establish a dialogue and change the narrative. That's just as important. And that may actually help us stop some of this legislation that would be coming through.
I think that's a good place to end on this topic of, you're talking about differentiating the Democratic Party from the Republican Party in what you view as a strategic way. Your first answer to my first question talked about affordability. You said, hey, you're hearing a lot about this buzzword of affordability. Republicans and Democrats in Georgia and around the country are both, in one way or another, talking about affordability.
Right.
You talk about differentiating. If Republicans and Democrats are talking about the same thing, is that a point of agreement, or do you see it as something that your party has a different view on?
Right, exactly. That's why I kind of laid out how we would approach affordability. So when you start talking about affordability, say with health care, we know Republicans and I supported Medicaid expansion. We know the bill last year to actually provide our own subsidies. If the federal government did not do that, we couldn't even get a hearing on that bill. And so when I talk about affordability as far as health is concerned, that is real. Paying your doctor is important. To be able to actually do, we have over $1 billion in uncompensated care. That's important. What could be more affordable? Make sure our doctors get compensated. What could be more affordable? Making sure that rural hospitals are not closing. What we've been doing so far has not been working. Not doing Medicaid expansion, not even giving our own subsidy bill even a hearing. That's not working. And understand how that works. Republicans, you remember back in the Reagan days, we talk about trickle-down economics. Well, understand what happens when a hospital closes. That means that doctor has to leave that community. There's no job there for that person anymore. That nurse has to leave that community. There's no job there for that person anymore. A person who's a janitor who worked on the food staff, they're leaving that community. They have no place to work anymore. So that's the trickle-down effect of us not actually doing the kind of policies that we've been producing as Democrats that we're saying we ought to use. That's what we mean. So we can both use the term, but then say, okay, now what is your policy to actually help people make things more affordable?
You know, you and I could talk about this for a long time, but I think this is a good place to cap it because there will be many more conversations to go as this session gets rolling in just a few days. Senator,
Absolutely.
thank you.
Thank you.
Appreciate it.
Thank you. Absolutely.